Hello, this is David Schwab, and welcome to the Schwab Report. Today, my guest is Dr. Richard Porcelli. Dr. Porcelli is a general and cosmetic dentist. Dr. Porcelli is a graduate of NYU College of Dentistry, and he practiced dentistry in New York City before moving to South Carolina. Dr. Porcelli currently has offices in Bluffton and Beaufort. Dr. Porcelli, I think many adults remember when dental fillings were those sort of dirty metal-colored fillings, but nowadays you're using tooth-colored fillings. Could you please talk about those tooth-colored fillings?
Well, the restorations that are being used today, composites have been around for a long time. They've just gotten a lot better. The chemistry behind them and the small molecular structure that is able to be used today has really allowed these restorations to be much more successful. I think that a very well-placed composite filling today will last as long or longer than an amalgam filling. One of the best things about the composites is that unlike the metal amalgam fillings, those preparations used to have to be bigger so that you can fit it in like a puzzle, because it only fit by mechanical retention, which means that it had to stick into the tooth and really kind of adhere into it just mechanically. The composites, we don't have to prep as much tooth structure, so we conserve a lot more tooth structure, and we use adhesives that will now keep that tooth in place into the tooth. And aside from the fact that functionally they're strong, they have a very strong wearability, so they last very, very well in the mouth from normal everyday functioning. But the beautiful aesthetics that they really produce when they're done very well, you can't even tell the difference that they're in the mouth compared to the natural tooth structure.
It's interesting to hear you talk about the aesthetics, but as you talk about the tooth-colored restorations, it sounds as though, if I can use this word, it's an even more conservative form of restoration. So it sounds like the best of both worlds, preserving more tooth structure and getting the good aesthetic.
Yeah, it really is. It takes a little bit more technique-wise, and one thing about composite fillings that everyone should be aware of is that we are doing a few more adjustments on them, because unlike the metal fillings where they used to get placed in when they were soft, when the patients would leave the office, they would kind of just settle into the mouth. With the composites, they're light cured, so when we cure them with the light, they become immediately hard. And many times the patient is under anesthetic, so when they're numb and they think that they're biting right, sometimes they're not biting right. When we're checking those little marks on the paper to adjust those bites, sometimes it could be off a little bit. So sometimes with these procedures, you are coming back occasionally for maybe one adjustment, possibly even two if you have to get the bite right. Everything with the mouth really comes down to balance. So even though we restore the mouth, getting those teeth very well balanced is what really creates the harmony in the mouth that gives you that good function and takes away any of the sensitivity from pressure.
I would like to thank Dr. Porcelli for joining me today. Dr. Porcelli is accepting new patients. He may be contacted in Bluffton through his website, BlufftonCenterForDentistry.com. In Beaufort, the website is BeaufortFamilyDentistry.com. This is David Schwab. Thanks for watching.